Namaskar, hello and welcome to Sansad TV. I am Namrata Singh and you are watching Sarokar. India is witnessing a remarkable demographic shift. Our elderly population, those aged 60 and above, is set to more than double from 100 million in 2011 to nearly 230 million by 2036. That means by 2036, 1 in every 7 Indians will be a senior citizen. It's a transformation that's reshaping our population, our families, and our responsibilities as a society. When we talk about aging, the conversation usually centers on physical challenges like joint pain, diabetes, hypertension, or heart disease. But there's another, often overlooked aspect of aging, and that is mental health. The emotional and psychological struggles of our elderly are frequently dismissed as just aging or mood swings. Yet, science tells us that mental health plays a vital role in healthy aging and overall well-being. According to WHO, around 14% of adults aged 70 and above live with a mental disorder, mainly depression and anxiety. Loneliness and social isolation make older people more vulnerable, yet these issues often go unnoticed. Many senior citizens do not get the help they need because of the stigma around mental health. The India Aging Report 2023 also points out that conditions like dementia and Alzheimer's are still misunderstood and carry a social stigma. In India, the problem is made worse by social isolation, lack of awareness, and changing family structures. So as more families move from joint to nuclear setups, many elderly people are left without emotional or social support. So mental health in old age, therefore, isn't just a medical concern. It's a social one that needs urgent attention. So, on our show today, we turn the spotlight on this pressing issue, mental health and aging. We will discuss how to identify mental health issues in older adults, what support systems are needed, and how society can play a role in ensuring that our seniors age with dignity, care, and compassion. So, to talk more on this, I'm joined by an astute panel of experts in the studio. I'm delighted to welcome Dr. Manjari Tripathi, Head, Neurology Department at AIIMS, Delhi. Dr. Tripathi, pleasure to have you with us on the show today. I'm also pleased to welcome Dr. Sudha Goel, Senior Consultant at Niti aayog. Dr. Goel, thank you for joining and welcome to Sansad TV. I also welcome my audience. Let me begin the discussion with you. By 2036, it's being said that nearly 1 in 7 Indians will be aged 60 years or above. And, globally, by 2030, 1 in 6 people will be over 60. And WHO says like around 14% of those above 70 live with mental disorders, like now. So what's behind this rise in mental health issues, both in India and abroad?
Thank you for inviting me to this particular session, a discussion on mental health amongst elderly, a very crucial subject, but often unaddressed. So Namrata, you have very rightly highlighted the issue and set the context. The question which you have put to me is very crucial, but the answer goes just beyond aging. With the demographic shift towards aging, as you have rightly pointed out, that the population of elderly aged 60 and above will become 20.8% from the existing level of 10.5%, as has been reported by the India Aging Report. 1/5 of the population in the Viksit Bharat will be of elderly aged 60 and above. So, the issue of aging and mental health is very crucial, but the answer, as you have already spoken also, is just beyond aging. So, WHO defines healthy aging as the process of development and maintenance of functional abilities, which also helps in the well-being in the elder age group. So, now this functional ability is a composite mix of intrinsic capacity and environmental factors. Intrinsic capacity in turn has 2 components, physical health as well as the mental health, and it includes the way we talk, hear, see, we decide, or we memorize things, or we consider taking decisions. While the environmental factors includes all those factors which are there in the family, the community, this broader society at large, the health and social policies, the health systems, and the services provided by these systems. So environmental factors is a mix of interaction between physical and the mental well-being. If everything goes fine, it results in healthy aging.
Okay.
And aging, as you know, there is an onset of chronic diseases like diabetes, mellitus, hypertension, arthritis, physical challenges related to mobility, then visual and hearing impairments. So all these changes are related to the biological things which are related to aging. But the answer is not only confined to the biological changes, it is a composite mix of environmental, social and economic factors.
Okay.
So when we talk about social factors, as you have pointed out about the social isolation, as per the longitudinal aging study of India, which is a study done by Ministry of Health and Family Welfare, it has been pointed out that 13% of the elderly, they live alone. 5% of them, they suffer from abuse by the family members, the caregivers, which is most often not reported because of the fear, the anxiety, and the lack of awareness about the legal rights and the protection. The urbanization, the migration, the breakage of the traditional family systems, all these factors have combined together to lead to more cases of social isolation and loneliness. So the family system is breaking, there is less number of people who can be the caregivers. When we talk about the economic aspects, we see that only 30% of the elderly, they are covered by any of the pension schemes, and only 18% are covered under the health insurance. So as we assume that elderly, they are less productive and they are dependent, and on the other hand, we are saying that they are not supported by the schemes which are there.
Right.
Most of the awareness related to the social welfare schemes and measures is very less as per the report. Lastly, if I talk about the healthcare systems, related to healthcare, there is no comprehensive package of services, especially for elderly. Though they are there, but the implementation challenges are there. There are no care pathways. We very less talk about the mental health, the preventive care that we need to provide to the elderly. So all these factors together, they result in mental illnesses, and so it becomes a composite mixture of both aging as well as the social and economic aspects.
So there are different reasons and aspects. So Dr. Tripathi, so mental health is simply, linked to aging, or there are deeper causes, like the most common mental health concerns are, depression, anxiety, dementia, Alzheimer's. And so for our viewers, if you could explain that if someone begins to forget something, so necessarily does it mean that they are developing dementia or Alzheimer's, or it's just related with aging?
All of us forget. Even I forget where I've kept things like keys or, spectacles, etc. So, but I remember that I have forgotten. Okay, so I'm aware that I kept my key somewhere and now I have forgotten. And then when I give my mind cues, and those cues are related to, I backtrack.
Right.
I backtrack on the steps. What was I doing before this? Where did I go? Then ultimately I do locate my keys. So the fact that everyone forgets, youngsters are forgetting nowadays, middle age, old age, everybody is forgetting, is a normal phenomenon, and this is because most of the time we are multitasking. We are doing several things at the same time, and the commonest distraction now is of course our screens. So we'll be doing something, okay, we'll be looking at the screen and go and keep the key somewhere. Okay, so obviously our mind was in the screen, but the key went by the hand and landed somewhere. So this kind of multitasking which we are doing nowadays, trying to do more and more at the same time, it kind of doesn't allow the memory to register.
Okay.
So whenever we do something or speak something or see something or read something, we have to first register it. Only when we register it, it will go to the next step. The next step is consolidation. So that consolidation cannot happen if you haven't even registered where you were keeping the key while looking at the mobile. But you remember you've forgotten and you backtrack, and so that's not dementia. That is not dementia. Please be rest assured. What is dementia? Now dementia is a condition where you have problems which come in slowly or may come in suddenly in remembering, in reading, in writing, in speaking, in word finding, in finding your way about, okay, visuospatial, or even calculations, okay, or judging a situation or responding to a situation, okay. And two or more of these happen, like memory plus calculation, or memory plus visuospatial, or memory plus behavior, and they are significant enough to impair the person's activities of daily living. Whatever activities the person has to do from morning to night, like brushing teeth, bathing, it is severe enough to impact these activities and make this person dependent on another person. Okay, so that is dementia. So dementia is a major chunk of neurological and mental health disorders. So also depression. As we age, particularly if we are retiring from work and we are not getting engaged in any other activity, our mind, will have these thoughts coming and going. It was so nice when I was before working, now I'm useless. And then it goes on like that, the thought mill runs through the mind and negative thoughts start coming. And this negative thoughts, if they are not neglected or ignored or interrupted, they can result in a state of depression. There's anxiety also, because many a times, many people do not have an insurance or they do not have a pension. So there's anxiety about what if I fall sick? What if I have to have a heart attack? What if I have cancer? So there's anxiety which gets generated at this age. This also results in mental health issues. So there are a lot of things, there's a lot of transitioning happening at this age, particularly from the age of retirement, which make it a fertile ground for having mental health disorders and dementia together.
And ma'am, so what is the difference between dementia and Alzheimer's? If you could explain a little bit.
So dementia is an umbrella term, okay, it's an umbrella. And umbrella is made up of segments. And these segments join together to form the umbrella. So in the dementia is again the umbrella. Under these are segments. And these segments, majority chunk is Alzheimer's dementia, followed by vascular cognitive impairment, followed by Parkinson's disease with dementia, diffuse Lewy body disease, frontotemporal dementia, dementia due to brain tumors, subdural hematoma, dementia due to low B12, dementia due to hypothyroidism. So these are, and there are many more conditions which come under this umbrella.
So Dr. Goel, from a layman's perspective, if you could explain that how can one identify the early signs of mental health issues in older adults?
As you highlighted also that 14% of the elderly, they suffer from mental illnesses. When we talk about India, as per the data, it has been reported that 9.5% of the elderly, they suffer from anxiety, 8.5% suffer from depression, 4.5% from dementia, and about 15% of the elderly, they fall in the category of less than 10th percentile of composite cognitive index.
Okay.
So you imagine that these many things are happening, but the family is not able to identify the early symptoms of all these illnesses. So if the family members or the caregivers, they notice that the elderly, they are having persistent sadness, irritability, confusion, forgetfulness, fading memory. So all these symptoms are the flag signs, red flag signs. So immediately they should get the person screened at the nearest health facility. And for that, I would like to explain to the audience, because there are many youngsters sitting.
Right.
In the primary healthcare delivery system, we have a system of continuum of care which starts from the community and then goes to the facility. In the community, we have frontline functionaries like ASHAs and AIIMS who visit and do house-to-house survey. In the house-to-house survey, if they are able to analyze these, if they are able to ask these questions, analyze the the illness, and bring those patients to the facility, then probably there will be early detection and early treatment to all these illnesses. Also, there are some physical symptoms like headache, digestive symptoms, which often mask the symptoms related to depression and anxiety. So basically, it is the upcoming of all those illnesses, but we are confusing them with physical symptoms like headache and the digestive systems. So these early symptoms have to be recognized. For that, we need to train the family, we need to train the family caregivers as well as the community and the health system functionaries.
Okay, so we need to train the family caregivers and health systems. Dr. Tripathi, so basically there is a relation between mental and physical health. So if you could explain that, experts even talk about the importance of physical exercise, cognitive engagement in keeping your brain healthy. So how much do these really help in preventing or delaying these issues?
Again, this is a very, very vital question, particularly because I have youngsters sitting here. See, if you are physically active, by physically active, I do not mean going to the gym and holding weights. By physically active, I mean being on your feet, sitting less. You are less likely to develop cognitive decline. And it has been proven by large number of studies. We don't need to prove it anymore. So being physically active, walking is the best. Jogging, plus minus, you can do it. Aerobics, cycling is very good. When you cycle, it prevents a lot of neurodegenerative conditions, particularly like Parkinson's, dementia. Cycling improves neuronal sprouting. It has been shown.
Okay.
Then, of course, comes environmental enrichment. If you're living isolated, if you're living lonely, if you're alone, you're more likely to develop depression, dementia, everything. So when your environment is enriched, so how do you enrich your environment? Have a good social network, dost, yaar, yaar, okay? Where you can laugh, where you can speak freely, where you can, let your stress down. Have a community network, have a family network, and have a social network which is healthy. This also prevents cognitive decline. Then, of course, comes the fact that learn new things. As we age, we should not sit idle. We should learn something new, whether it's a new instrument like a guitar or a violin or a new language. Okay, suppose you're from Tamil Nadu, learn Hindi. Suppose you're from North India, learn Tamil. It is going to stave off dementia by 5 to 6 years. It has been proven. So learning a new language is a very, very good way. Learning music, okay, listening to music. Learning dance. Dance has been shown to prevent cognitive decline. Okay, learning any form of dance, not some dance which injures your spine and back and all that, not break dance, which at old age, if you start doing break dance, anything can happen, you can fall. But the gentle steps. So basically, all these physical activities, these are just physical. And there's so many more non-physical activities which can prevent, dementia, which can prevent depression and can lead to healthier aging.
Like when playing, brain games like Sudoku and all.
Absolutely. So I just told about the physical. But then again for the youngsters here, it is for you to know that when we play brain games, we are engaging our brain, we are challenging our brain. Not looking at the television passively, because when you're just looking at the television, you're just doing a passive activity. Wherever the brain is being challenged by chess, Sudoku, puzzles, painting, drawing, all this will prevent cognitive decline. So these are the non-physical activities. These are the mental activities, okay? Recently, it has been shown that virtual games, you have virtual headsets where they look and they're playing. Those are also good. There are particular games to prevent cognitive decline also. This is for you youngsters. Then, these are the non-physical activities. But there are many more activities which are important. One is, it has been shown that if you are, eating the right kind of stuff, and this is for you youngsters, particularly avoid refined foods. So what are these refined foods? Maida, anything with maida. And what is with maida? Your cakes, your bakery stuff, your bread, avoid them. Pasta, avoid it. The momos which you're eating, if it's made from maida, the covering, avoid it. So anything which has white maida, avoid it. Anything which is refined and processed, particularly if it is ultra processed, avoid it. So what is ultra processed? Don't eat non-vegetarian if it is red. You know what is red meat? Red meat is like the goat meat.
Right.
So eat, if you have to be non-veg, choose the white meats rather than the red meats.
Right.
And eat more greens. Your dal. Haldi. Do you know? A broad research has been done to show haldi is healthy. Okay? Because it prevents the accumulation of amyloid beta and neurofibrillary tangles, which are the pathology of dementia, of Alzheimer's kind. Having haldi in our diet is good.
Okay,
Eat greens.
So basically, ma'am, healthy eating, engage in different activities. These are some of the important, things to do to avoid this thing. Dr. Goel, so gender also plays a significant role in, shaping senior citizens' mental health, and it's being said that women suffer more from dementia and Alzheimer's than men. What is the reason?
Very right you are, Namrata. Women suffer more than men related to dementia and Alzheimer, and this is not only biological, it again has a social impact, you know, and reason behind it. So, and also the demography. If you see the demography, women live longer than men, right? And age is the strongest factor for dementia. So, the more life you have, the more chances of getting dementia is there.
Right.
First is this. When we see the life expectancy, it has been seen that starting from the year 1985, the interval between the life expectancy of males and female has been going in favor of females. And this is about 3.1 years more for females as compared to males. When we talk about senior sex ratio, we see that by 2036, the senior sex ratio will become 1078 per 1000 males. So this is all called as feminization of the society, of the community, of the senior citizens. So all these factors, they lead to somehow the mental illnesses related to dementia and Alzheimer's. Also, when we talk about elderly women, they suffer from widowhood, social isolation, the financial insecurity is there, and it has been seen that 54% of the women who are elderly are going to be widowed as compared to just 16.5% of the males, and this is more in 80 plus women.
Okay.
So the challenges related to age are more in women as compared to
men.
Male.
Right.
And this leads to more chances of getting dementia, Alzheimer's and all other related mental illnesses.
Right.
And financial insecurity, Namrata, somehow plays a major role because they are dependent, they don't have any regular source of income, there is nobody to look after them. So, and this is more so in rural areas where the caregivers are less, the family size is shrinking, the people who need to take care are moving to the urban areas.
Right.
So all these factors combined together lead to more chances of getting dementia and Alzheimer's in elderly women as compared to
men. Dr. Tripathi, before I go to the audience for questions, one thing I'd like to ask you that, in country like ours, mental health still carries a lot of stigma around it. Visiting our psychiatrist is, or even talking about that, is still very less. So, ma'am, how can we raise social awareness?
So this this is actually a fact that the moment you utter the word that you need to see a psychiatrist, people take 10 steps back and they don't want to see a psychiatrist. So this, I would say, is a very immature way of looking at things because you are missing out professional advice. And these people who are victims of stigma or are generating the stigma, they are more likely to land up using wrong treatments. So we've seen patients who are depressed who've got addicted to diazepam or benzodiazepine.
Right.
Because they have been taking it over the counter and they've been taking it out of prescription. They have not got the correct treatment for their depression. And now they cannot come off their diazepam or alprazolam or whatever. And they have become addicts at a later age. So this is really sad. And the only way to generate awareness is to have information, education, knowledge campaigns. And these campaigns should be at par with the Do Boon Zindagi Ke campaign. They should be campaigns with prominent personalities who are speaking for depression and who are speaking for dementia or any disorder, and they should be given free airtime in major news channels in the country, in major YouTube channels. YouTube often puts an advertisement. Along with the advertisement, put the advertisement, but give some time for health education, which is not costly because you cannot make health costly if it has to reach out to the masses. I would like to add to Dr. Sudha's statement about why women have more cognitive decline or depression, etc. See, women are more homebound, isn't it? Especially in rural areas, the women are more homebound. They are confined to their homes. Now at old age, what do you develop? You develop cataract, you develop hearing loss. Now, hearing loss and cataract, if not corrected, are a major risk factor for cognitive decline and depression. Okay? So, they are less likely to be brought to the hospital for hearing loss or for cataract. As a result, they are unable to perceive the environment. After all, how do we form memories? We form memories by perception. We are perceiving, you're perceiving me through your ears right now. You're perceiving me through your sight. Now suppose the hearing is gone and the sight is gone, nothing is getting registered, okay? So the first step of memory is again gone.
Right.
So hearing and blindness at older age is less likely to be corrected in women as compared to men because they are homebound.
So now let me open the floor for my audience. Introduce yourself and speak your mind.
Hello ma'am, myself Srishti Basnal and I'm from Hiring Business School. My question for you is, sometimes my grandparents have a bit more emotional trouble and they have some emotional troubles, they have some outbursts. So how do I help them with their emotional stage? When they are so emotional that we can't handle them, so how do I regulate their emotions?
You can, my best advice to you is you cannot regulate anybody else's emotions, okay? You can only regulate your own. So first thing is that, what we take out as an emotional outburst is very often due to our past experiences and past challenges, and they may have faced many, they have seen the freedom struggle also. So they may have faced many. Those challenges we don't face today. We have better living conditions than they had. So first of all, when there is an outburst, one has to be very, very silent as an observer. One should not judge. One should not pass a comment which is hurting them. So just listen them out. Then when everything is over, maybe when they are in a better state, then you can talk to them about it and tell them why you're concerned, because it may impact their health. Okay? So don't charge in there, and we shouldn't be judging them, we shouldn't be shouting back, but we can just silently observe, hear it, and then when the situation is a little calmer, then handle it in a lighter way. The second thing is, if it's out of hand, sometimes there's a lot of aggression, and sometimes, elderly people become physically violent also, in which case you should seek professional help. Because, there could be situations where anybody could be harmed by this kind of activity. So, that is where you have to take a professional help.
Dr. Goel, you would like to add something?
Yeah. So, very rightly pointed out by the audience, very intelligent people actually. The family-centric approach to healthy aging is the concept. So, when we talk about teaching our children, actually this should start in the school. It should be a part of the school curriculum. How to handle your elders and give them respect, nurture the family values, customs, cultures, all this is very important. So first thing is that you should start from the basic and how to handle the emotions, Dr. Tripathi has rightly pointed out. But listening is very important. Actually to listen to the person who is in emotional trauma is very important without any judgment. This is one thing. Secondly, there is a concept of community-based care. In rural areas, we do not have many people to provide the health care. So the community-based care concept is coming. So in that, the people are there who are forming the social groups. There are social spaces where the people can go, the elderly can go, they can interact with their peer groups. They can listen to their stories, their experiences, and their sharing also. So all this helps in building the social connections and, improving the cognitive health of the elderly. So this is important. And lastly, the role of healthcare system is very important. As I already said, the field level functionaries, they should be trained enough to listen to the problems of seniors. They should devote some time and then, analyze and teach the family and the caregivers also, especially the children in the family, the intergenerational programs. This also is a new concept where the children, they talk about their own things while the parents, they share their experiences. So it's a learning between the two. And this reduces the generation gap also. So these are the things which I wanted to add.
So interaction is crucial, basically. Right. Any other question?
I am Richa Kumari from Hiring Business School. My question is that when we are too much reserved, the chance of depression and anxiety is more.
So basically, she means that if somebody is very introvert, so are there chances of suffering from dementia, Alzheimer is more?
I do not know the statistics, Bache, but I can tell you that depression happens in many people who are out there working and doing everything and they are not able to communicate. So depression is a state of the mind, And that mind only you know, or only I will know my mind. So the questions to be asked is, am I happy? Am I, looking forward to going out and doing this? And when you get no answers, then that is the time you have to consult the professional. And yes, maybe those who are isolated, introvert, it's a little bit more than those who are extrovert.
My name is Swati Tomar. So I want to ask about the report. NCRB says that the committed suicide of the aged 16 plus in senior citizens have 15,339, which is increased by 40% during these 4 years. So what happened in these 4 years? The case have been increased to 40%.
It's a very good question, and both of us can take it. Just last week, we had a 80-year-old lady who had consumed more than 30 tablets of a medicine and come. It is very, very sad and painful to see this situation. Now, why is this happening? Because they are feeling left out, okay? Left out by the family, left out by the community, left out by the society. Then they do not have anything to look forward to, okay? And third, last but not the least, they do not know what is at the end. They know that at some point of time they're going to drop out of life. So there's always this sense of fear and dread, okay, of losing everything. So there are a number of reasons why elderly depression, elderly suicide attempts and suicide have increased. And it is a big mental health challenge. I think Dr. Sudha can also pitch in.
Absolutely. Actually, this period of 4 years included the period of pandemic also. Right?
So has this happened, ma'am, because of the pandemic? Like post-pandemic, this has increased?
That's what I'm trying to say, actually. So absolutely, you're right, because, pandemic, that increased not only the physical isolation, but the fragmentation of the emotional and the social connections was also there. So the intensity of grief because of the loss of spouse, caregivers, social connect was more. And this led to the increased prevalence of mental illnesses. Also, because the routine healthcare system got disrupted. So the people who were taking care for chronic illnesses, for the mental illnesses, they were not able to get the treatment on time. So that also led to increase in the prevalence of mental illnesses. It also has a financial, angle also. You talked about people committing suicide. Now, because of the social isolation and the lack of financial support, so these things have increased the vulnerability of the seniors towards financial frauds. And you must have read in the paper, there are many cases of seniors committing suicide because of this. So financial insecurity, social disconnect, and the isolation. These are the main reasons. And the people, the family caregivers, they don't have time to listen to their parents. So these are the reasons why people are committing suicide. And for this, we need to have a multi-dimensional, multi-sectorial and multifactorial approach in which you people as young generation can play a major.
As you can see, like we are in India and therapies are very not known to the world. So do you really think that our elders should get therapy because children and other people are not that close to their family, right? And elders don't have friends like us. So do you really think therapies can help them?
This is again a very good question. And yes, of course, if you pick up any change in your elderly in the house, whether it's in memory, whether it's in mind-related issues, one must consult a professional. And therapy also should be done by a trained professional, but only if it is to a pathological level. If it's mild and if it can be managed by behavior and environment change in the house, when it's mild, that would be the best.
So basically, interaction is the key. Begin from the basic, eat healthy, interact with your elders, and healing the mind helps heal the body. And aging well isn't just about adding years to life, it's about adding life to those years through care, compassion, and mental well-being. With that, it's a wrap on this show. Thank you, Dr. Tripathi and Dr. Goel, for giving your insights on this pressing issue. And thank you, our audience, and to our viewers. Thank you for your time. Stay tuned and keep watching Sansad TV. To watch more programs of Sansad TV, subscribe to our YouTube channel and don't forget to like and share them.